Hi, this is Dr. Siegfried again, and welcome to another home health care video. Today we're going to talk about your shoulder, your neck, and your upper back. But we're going to primarily focus on shoulder pain because it's a big problem, especially if you're right-handed, it's a big problem. If you're left-handed, it's a big problem. And one of the biggest reasons is because we're sitting so much. Where, for example, if you're sitting at a computer all day, if you evaluate your posture there, what happens is a lot of times you're like this and your hands out like this. And that's stretching all the muscles and ligaments of the shoulder girdle. A way to change that is to raise your computer up so that your head's like this, but still you've got your arm out. Or sometimes it's back like this. But the point is, it's favoring the shoulder and the neck and the arm while you're sitting at a computer. And that's just one aspect of shoulder pain that's coming from the neck, that could be coming from the neck. The other aspect of shoulder pain is, like, for example, I've been pitching baseball for many years, and one of the most common problems with pitchers is shoulder pain, or throwers of any kind is shoulder pain, and it's because this activity is jamming the shoulder joint essentially all the time. Now, if that jamming is not relieved, you can exercise all day long, and it's not that it won't help, but you've got to get the pressure off the joints, which is ultimately putting pressure on the nerves, which is causing the muscles to not be able to relax to do their job. So what we have to do with, for example, shoulder pain is the first thing is this. You have to get the pressure off the nerves, because it's like this. If the nerve is pinched, your power supply is down. And when you're trying to use your muscles when the nerves are pinched, it's like driving around with the brakes on. It just doesn't work very well. You get the pressure off the nerves, then you got more power, and then you can start using the shoulder, neck, upper back muscles the way they're supposed to be. So I'm going to show you some exercises that you can do today, plus a traction maneuver that you can do at home to help with shoulder, neck, and upper back pain. But I want to make one point. If you've got a torn shoulder, torn rotator cuff, that's a different story. We're not talking about that necessarily. However, a lot of people that have tears in their shoulder muscles can't afford to get them fixed, or it's not a surgical situation. And again, this will help manage the situation from a purely mechanical standpoint. We're not talking about nutrition right now. We're talking strictly mechanics, namely getting the shoulder joint to work properly, the neck to work properly, and the upper back to work properly so that the muscles can do their job, backing up the ligaments in the spine. So let's go and I'll show you. Now these are very, very simple. And all you need is a doorway. And you can do this in an office, you can do it at home, you can do it at the gym. And one of the most basic ones is to just put your arms up like this. And you just lean forward. You can lean forward like this, and then you can put your head back. Now, depending on how tight or restricted your neck is and your upper back is, that's going to determine sometimes how much of a stretch you can get, which is why you might need to have your shoulder, your neck, or your upper back adjusted. Even your lower back, because the pelvis is very much involved with the shoulder joints. But we're going to focus right now strictly on stretching this shoulder. So the point is you can stand like this and count to 5. 1001, 1002, 1003, 1004, 1005. And you can vary it. You can stand like this and lean even further in. And what happens when you lean further in like this, you're going to feel it stretch out here. And this is working both sides, so it's bilateral or symmetrical stretching, as we call it. Another stretch you can do is to just stand like this and lean forward. These are very gentle. You put your palms on the side of the door and you just lean forward and you go like this again and you count to maybe 5. You're going to feel this in a different part of the shoulder. And then another very simple one is to put your arms up even higher and go like this, counting to 5 like I told you before. And then you relax, and then you can go back if you want. So those are a couple very simple stretches. Now, let's say you have a wall. Let's go over here. You can do something as simple as standing, and this is a very common one that people use. You can lean into the wall like this. This is very good. It's a very good stretch. In fact, what you can also do is like little push-ups like this, which are very, very good for the shoulder muscles. So that's that. Now, let me show you one other thing. To loosen up, just to simply loosen up the neck or the neck and the shoulder. Let's say you're at a desk or let's say you're warming up before you go play ball or whatever. Stiffness in the morning, these are called head rolls. You can go like this a few times each way, very, very, very gently. And then you can go back and forth like this a few times, very, very gently. You can go up and back like this a few times, very, very gently. Like this a few times, very, very gently. The benefit of that is two things. Number one, it loosens up the joints, but it also gets the nervous system aware of the fact that you're going to be doing some extra motion, which allows the power supply to go out to the shoulders. So that's another aspect of shoulder and neck and upper back problems. And finally, I'm going to show you something you can do to traction your neck. It's as simple as this. You can take a rolled up towel like this. Depending on the size of your neck, you can make it bigger or smaller. And you simply put this under your neck like this. And you lay like this for a good 5 to 10 minutes at a time. That can be extremely valuable. Another stretch that you can do while you're doing this is to just put your arms like this. You can do this on the floor if you want. And finally, there's a stretch where you can take a towel like this and put it right between your shoulder blades and lean back. And you can lay like this. It's pushing up. As it pushes up, it actually stretches the spine up into the neck, opening up the nerve channels. So you can lay like this for a few minutes, and then you can put your arms like this, and you'll feel even more of a stretch. So the point is, this traction maneuver is pushing up on your spine and tractioning the spine, opening up the nerve channels, so these muscles in the shoulders and the neck and the upper back have the power that they need to do what you want to do. So that's how you can do this at home. And you can do it on the floor, you can do it in the bed, whichever you prefer. So that's what I wanted to talk to you today about, was how to take care of the shoulder, neck, and upper back pain, and what you can do at home. I hope this is of some help to you, and if you have any other questions, you can call me at the clinic in McMinnville at 503-472-6550, or you can call the Portland office 503-977-0055, or you can go to my website. If you have any questions you want to email me, feel free to. Thanks a lot for listening. Thanks a lot for watching. And if you need any more help, give me a call. Thank you. Bye.